Hello, my name is Lori Reed, and I'm an holistic therapist certified in reflexology and Indian head massage. And I wanted to talk to you today about an alternative therapy called reflexology, one that is deeply relaxing, highly effective, and can also be given to your babies, is very, very safe for babies. So, what is reflexology? Well, it is the practice of focused pressure on 5 zones in each of your feet or your hands that directly map to every gland, tissue, organ, and system in the body. So if I'm working on your right foot, I am impacting everything in your body on the right side of your body. And subsequently, if I'm working on your left foot, I am impacting all of the systems, tissues, organs, glands on the left side of your body. So what are on those sides of the body? Where there are shared organs across both sides, such as the lungs, the digestive areas, small and large intestines, the pelvic area, the brain, there are also organs that are unique to one side or the other. For example, you would find your liver, your gallbladder, your liver, gallbladder on the right side of your body, and you would find your spleen on the left side of your body, for example. So how does it work? As a reflexologist, I am working on your central nervous system, pressing and pushing hundreds of thousands of nervous impulses around your body. My pressure is not supposed to be super deep pressure, but it needs to be deep enough that it does not tickle you and that it does impact the central nervous system. So it feels glorious to have a treatment done. When I'm pressing on the feet, it's amazing how relaxing it is. That said, when I am pressing along those zones in your feet or your hands, and I come across a very tender, perhaps painful spot in your foot, and you might jump a little bit and say, oh my goodness, what was that? I can then tell you what that spot refers to in your body. 9 times out of 10, you're fascinated by what I'm saying. So if it's something that's painful in your foot, it possibly means something is going on in that referred part of the body. It doesn't always mean that, but it often does. For example, I might be pressing on your shoulder on the right side of your body, and you would say, oh my goodness, that was really painful. What was that? Well, that's your shoulder, and it's on the right side of your body. And you would then say, oh my goodness, last year I had a rotator cuff operation. So then we would say, well, that's probably some scar tissue left over from that operation, and that also can cause some pain or discomfort in your foot. So it is fascinating how accurate and how precise it can be. So, for instance, I might be working on the lower part of your leg, on the outer side of your leg, underneath your ankle bone, and maybe that area comes up as a tender spot. And so you might say, oh my goodness, what was that? That didn't feel very good. That is actually your hip, your lower back, and your sciatic nerve area. So again, it covers off 3 areas underneath the ankle on the outside of the leg. So it's interesting how it maps, and often it's quite precise and very fascinating. A 1-hour session of reflexology offers amazing benefits. It helps increase circulation of both your blood and your lymphatic fluids in the body. And we want those to be moving all the time and not getting blocked up and not stopping. We want things to move. Circulation is key to life. It works with your circadian rhythms to enhance the quality of your sleep. It removes stress in your body for up to 3 days after a session. And I want to speak to that point. We all need to carry a little bit of stress around with us just to do just to make decisions, to drive our cars, to work in our jobs, to take care of our families. We need a little bit of stress to be able to react and respond. We don't need a lot of stress over a long period of time. That puts us at risk, and it impacts the immune system by increasing cortisol hormone in your blood system. And having increased stress in your life and increased cortisol hormone in your body over a period of time can put you at risk for diseases, for sicknesses, for bacteria, viral things, infections, colds, flu. So you want to keep that stress at bay, okay? Another benefit is that it improves the good digestive health in your body, so it enhances that. And it is clearly one of the most deeply relaxing therapies available. In reflexology, we approach your body as a whole. While you might come in and say, oh, I've been really aching up here, and that's something you might say to a massage therapist. I want to know those things as well. Even though I'm going to approach your feet and your body as a whole, I am going to come across those areas of concern, and we can work a little more on those areas. And often it alleviates a lot of the pain because you're having endorphins happening in your body, good feeling endorphins. By way of people just touching your feet is gentle and lovely and promotes happiness and all of that. So all of those things play into how you feel pain. And so getting back to the point that we will look after your whole body. When we do that, we put the body into a state of homeostasis. What is that? That is the state of balance. And it is thought that if your body is in a state of balance where all the systems are working harmoniously and things are working well and your cells are thriving and your blood is moving and all of it, that you can then thwart off any kinds of issues coming your way. So it's really, really a wonderful treatment, a wonderful session to have. And it is appropriate for babies. It's completely healthy. It's very effective. And it is a good thing to know to have this as a tool in your toolbox when your baby is crying a lot, when your baby is pulling her knees up to her chest and screaming. You might think, oh my goodness, that's got to be pain or something. When baby is rubbing her hand into her mouth or chewing hard on a toy, she's teething possibly. We look for lots of signs of what's causing our babies to cry. We learn to listen to what their cries mean, and we respond. And obviously we pick them up and we do what we're supposed to do. We feed them, we change them. They may need to go to bed. But if you have some reflexology in your toolbox, there's another tool for you to try on your baby. So in subsequent videos, I will show you how to do reflexology and what areas the baby feet that you need to massage. And I'll teach you the proper technique to look after baby's feet. So thank you for listening, and I hope to see you in future videos. My name is Lori Reed, reflexologist, Indian head massage. Thank you so much. Bye for now.